Welcome to the all viewers and well-wishers of the world. Purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot, and now it's time to return a lot to the word. The topic of today is bacterial pathogenesis. It includes pathogenicity, toxigenicity, virulence of the bacteria. A multifactorial process depends upon the immune status of the host, the nature of the species or the strains, and the number of the organism in initial exposure. It includes initiation of the infection, causing signs and symptoms of the bacterial disease, outcome of the interaction between bacterial damage to the host and opposed by the host defenses mechanism. Bacterial pathogenesis includes bacterial adherence to the host cell, invasiveness, toxigenicity, ability to evade host immune response so that they can survive in the host, finally bacteria or the immunological reactions by the body injure host and it causes the disease. Humans have normal microflora which do not produce disease but now allow pathogenic bacteria to survive, grow, and propagation of the bacteria in the host. That is all bacterial pathogenesis. Sometimes clearly pathogenic bacteria like Salmonella typhi are present in the host, but infection remains latent or subclinical and the host is called the carrier of the bacteria. It can just propagate the infection to the other, but the person who is harboring all these bacteria is not having any disease. So pathogenesis, the term definition is initiation of the infectious process causing signs and symptoms of the bacterial disease, disease process, course of the disease, and the development of the disease. Pathogenicity is the capacity or the ability of a bacterium, microbe to cause disease. Toxigenicity, it is the ability of the microbe to produce a toxin that produces diseases. Virulence, it is the measure of the pathogenicity of an organism, like the venom of a snake, how much it is dangerous and poisonous. So disease is illness or the change in the health due to the infection. Symptoms are the subjective changes the patient complained to the doctor, and signs are the objective changes, observable changes, measurable changes which the physician can observe. Syndrome is the specific symptoms and the sign seen in a particular disease, and incidence is the number of people in population who develop disease during a certain time, like year or 5 year or 10 year. Prevalence is the number of people in a population that have disease at a specific time or any given time. Carrier is the infected person without detectable signs. As I have told you previously, he is or she is asymptomatic, but it can transmit the infection to the another, but himself or herself is disease-free. Here one can see the symptom, a person complaining of the headache or complaining of the very high-grade fever, but it is the doctor who is going to check the blood pressure. So the blood pressure is the sign, headache is the symptom. Similarly, the feverish feeling and the fever checked by the physician is the sign. So invasion is the process by which infectious agent enter into the host body and spread in the body. Communicable disease is transmitted from one host to another host. Contagious disease is easily transmitted disease from one host to another host, like COVID, and sporadic the disease which occurs only occasionally, endemic, constantly and always present in a population, and epidemic is the outbreak. Many people in a given area get disease in a short time period, and the pandemic is the worldwide outbreak of any disease. So, occurrence of a disease or severity or duration of a disease is a primary infection, initial infection. Patient may get a secondary or superadded infection later on. The patient admitted in the hospital with the initial infection, and there he or she can get the secondary or the superadded infection. Acute infection, rapid onset of the symptom that lasts for a very short time, and the chronic infection, slow onset of the symptom that lasts for longer time like weeks and months. Latent infection remains inactive, or we can say the hidden infection then becomes active again to produce the symptom when the immunity of the body is low. So that is called the latent or hidden infection. Now the development of the disease, incubation period is the time interval between initial infection and first appearance of the signs and symptom. The bacteria have got entry and appearance of the symptom is all incubation period. Prodromal period, early mild symptom before the true symptom of that specific disease like cold or feverish feeling, that is called prodromal period. Period of illness when the disease is most acute, and the period of decline when signs and symptoms start declining and there is recovery. So period of convalescence is the recovery period. Person regains strength and body return to the pre-disease state is the period of convalescence. Here one can see the incubation period, no sign and symptom, the first few days, and then prodromal period, there is the mild signs and symptom. Then there is the period of illness, that is when the most severe signs and symptoms appear of any particular disease. Then the disease start declining, so that is the period of decline, sign and symptom start decreasing, and ultimately the disease finishes, and there is the period of convalescence when body start recovering from the disease or the damage done to the body by the pathogenic bacteria. Now, mechanism of disease production by the microbes is by the two mechanisms. One is the toxin production. These are the exotoxin production seen in gram-positive bacteria, and endotoxin production seen in the gram-negative bacteria, rods and cocci. And the other process is the inflammatory response of the body by invasive bacteria like erythema, edema, pain, and the warmth. That is the inflammatory response of the body towards those bacteria that is also responsible for causing the disease and problems. Host involvement, local infection versus systemic infection. Focal infection starts, local infection means the localized area of the body is involved, and systemic infection when the infection from the local area get entry into the blood and that can reach to the other organs of the body, that is called systemic infection. Focal infection starts in one spot and then spreads. Bacteremia, it is the bacteria in the bloodstream. Septicemia, bacteria multiply in the bloodstream and produce the toxins. And toxemia, when the toxins produced in the blood are circulating in the blood, that is toxemia. Primary infection is the initial cause of the illness. It just started at GIT, suppose. And secondary infection, opportunists take advantage, more serious than the primary infection. The person is admitted in the hospital for the gut infection, and there the patient have got the pneumonia and the more serious infection. Now, the wrong is wrong, even if everyone is doing it. and the right is right, even if only you are doing it. You are going to be sure that you are right, even if you are alone. That is sufficient for you, that right is right and you are not following the wrong path. Now, groups of the bacteria which involve in infection: frank or primary pathogens, a microbe capable of causing disease identified by the laboratory diagnosis. Salmonella species from the feces causing the diarrhea is the frank or primary pathogen. Opportunist pathogens cause disease only when the host resistance is impaired and also infect sterile tissue or the organ. They cause disease like UTI with Escherichia coli by catheterization. So these are the opportunist pathogen. And the other group of the bacteria is the non-pathogens. These are the Lactobacillus acidophilus, cause no human disease, maybe the normal flora. These are changed because of the adaptability, radiation therapy, chemotherapy, and immunotherapy. And some non-pathogen can cause disease now under the influence of all these changes which has occurred because of the radiation therapy and chemotherapy. Serratia marcescens, a soil bacterium, cause pneumonia, UTI, and bacteremia when they get opportunity in immunocompromised host. Now, microbes and the humans, if very few microbes are always pathogen, many microbes are potentially pathogenic, and most microbes are never pathogenic. They are just residing there, and very few percentage of the microbes are dangerous and causing the death of the patient. Now, how bacteria cause damage to the host cell? Only if pathogenic bacteria overcome the host defense, then they are capable of causing damage to the host cells. And number one mechanism is using the host cell nutrients. Number two, causing the direct damage. Number three, producing the toxins. Number four, by the hypersensitivity reaction by the body. So number one, using the host cell nutrients. Bacteria require iron for their growth. Most iron in the host body is tightly bound to the iron transport proteins. Some bacteria produce siderophores that are capable of taking iron of the host away from the iron transport proteins. Number two, causing the direct damage. Bacteria used host cell food and produced waste products. These waste products accumulate in the host cells as the bacteria multiply. Now the host cells rupture and the bacteria just get released from these host cell and bacteria move to the another host cells, causing the direct damage. Here one can see the bacterium and the bacterial receptors, but these are having the siderophores which are capable of getting the iron inside the bacteria, and bacteria start multiplying. Similarly, here one can see the bacterial cell and the iron molecule. The receptor site on the bacterial cell is going to receive the iron, but only with the help of the siderophore. And here one can see the siderophore join the iron and takes the iron to the bacterial cell. And here one can see the outer membrane and the cytoplasmic membrane of the bacterial cells and the peptidoglycan, and there are the holes, and these are the way by which the bacteria just take these iron and the other food and just make busy the antibodies with their receptor so that it is not going to cause the damage to the bacteria, and bacteria just have from these pores the different molecules inside their cytoplasm. Production of the toxins. There are two types of the toxin production, endotoxin and exotoxin. These produce fever, cardiovascular disturbances, diarrhea, and the shock. Inhibit protein synthesis, destroy the red blood cells, disrupt the nervous system of the host, and inducing the hypersensitivity reaction. Bacteria attack host which produce antibodies against it. Now bacteria attack and its antigen react with already formed previous antibodies. These newly formed immune complexes, that is the combination of antibodies and antigens, do damage the host. Here one can see the exotoxin of the gram-positive bacteria. These bacteria just synthesize the toxin and release it in the form of exotoxin, but the cell wall of the gram-negative bacteria is going to disintegrate to produce the endotoxin. And the immune complex, as one can see, antigen and antibodies makes the antibody immune complex which is going to destroy the host. Here one can see the antibodies joining with the antigens and making the immune complexes which are responsible. So antigen and antibody complex are the immune complex which are going to destroy the host. Now, stages of the bacterial pathogenesis, these are: number one, transmission from the external source into the host, that is the portal of entry or reach to the host cell. Number two, adherence to the mucous membrane or the other cell surfaces by the pili of the bacteria. Evasion from the primary host defense, skin or acid of the stomach, so that they can survive and cause infection. Number four, colonization and the growth of the bacteria inside the host cells. Number five, toxin production by the bacteria and inflammatory response by the host, causing the symptom. Number six, evasion from the secondary host response, that is innate and acquired immunity of the host, by which the bacteria just wait and able to reach in the host and survive in the host. Progression or the resolution of the disease. So, number one is the transmission of the bacteria. It means transfer or travel of the bacteria from source to the susceptible host. Transmission is done by the different routes. These are called portal of entry. Number one is the respiratory tract portal, that is called inhalation, also called airborne transmission. Droplet nuclei or the dust carrying the infection travel via the air from the reservoir to the host. Larger droplets expelled during talking, coughing or sneezing. They settle down on the floor, carpets, furniture, clothes and become the part of the dust. These cause common cold, influenza, measles, mumps, tuberculosis and whooping cough. These are all caused by the droplet or airborne infection. Here one can see the person is coughing and just putting the droplet in the air, and if that air is being taken up, inhaled by another host, so there is a transmission of the bacteria from this host to the another host. Gastrointestinal tract are called ingestion or contaminated food or water cause intestinal infection like cholera, dysentery, food poisoning. And these ingestion is through waterborne, like water contaminated with the untreated or the poorly treated sewage and contaminated with the feces. The other is foodborne, incompletely cooked, poorly refrigerated or prepared under unsanitary condition food can be responsible for transmitting through ingestion. Then third is urogenital tract, that is the sexual tract, responsible for transmitting venereal disease like syphilis or gonorrhea. Then the fourth transmission way is skin or the contact, that is the opening abnormal area of the mucous membrane, cuts, burns, trauma, needle sticks or the catheters which have broken the skin, so that cause the contact transmission. It can be direct contact, physical contact between microbes and the host like skin and sexual contact. Indirect contact, when microbes transmitted from reservoir to the host by the non-living objects. These are the 5 F's for flies, fingers, fomites, the belonging of the patients, food and fluid. The fifth way of transmission is zoonosis. Infectious disease transmitted from animal to the man through the milk, through the meat and the other things being used of the animal by the human being. Animal can be the source, reservoir or vector of the transmission. Here one can see the water going into the mouth and the feces contaminated with food, contaminated with the feces, and the water contaminated with the feces is going to be taken by the mouth by the ingestion way. Then contagious infection by the direct contact of the skin, then by the insects, this causing the bites in the skin that can transmit the infection, and also transmit by their legs and the other body parts to transmit to the skin, and through the break in the skin that can go into the human body. Then one can see the sexual contact or the direct skin contact by kissing or the sexual intercourse. That is also one of the way. Then transmission is sixth. Transmission is vertical transmission. That is from the mother to child. Number one is via placenta. Intrautero pathogens cross the placental barrier, which usually do not cross, but some teratogenic infections like torch agents, these are the Toxoplasma gondii, rubella virus, cytomegalovirus and herpes virus, can cross the placental barrier and can infect the child in the mother's womb. Now, the other way is within birth canal during the birth or by lactation when the mother is feeding. So there is chance of having infection through the mother via lactation. The other infection is hospital acquired or the community acquired infection. That is also the vertical transmission. The patient is in the hospital and get that. Then number 7 is the horizontal transmission. It applies to the most infection from person to person. That is called horizontal, from one person to the another, and the vertical is directly from the mother to the child. Now continued transmission is horizontal transmission. Some infections are caused by the normal flora, most acquired by the external source. Pathogens exit from the infected person, mostly by the respiratory and the GI tract. I have already told you these are transmitted to the new host via droplet, fecal contamination of the food or water. So these are all horizontal transmission from one person to another person. The 8th transmission is iatrogenic and laboratory infection by unsterile syringes and the surgical equipment used by the laboratory people. Physician-induced infection during processing like injections, lumbar puncture, surgery, and the catheterization in AIDS and hepatitis B patients. Laboratory personnel handling the infectious material, doing mouth pipetting. These are all coming under iatrogenic and the laboratory infections. And the 9th is inoculation or the vector transmission, that is by the arthropod bites. Pathogens reach into or beneath the skin or the mucous membrane, tetanus spores implanted in the deep wounds, rabies virus deposited under the skin by the dog bite, arbovirus injected by the insect vectors like mosquito, ticks and other. And mechanical transmission, the passive transport of the pathogens on the insect feet or the other body parts like flies. These are sitting on the skin and transmitting the infection. So this is the summary of the transmission of the bacteria from one person to another. That is, one can see by the needles prick, then by a droplet infection, by a blood transfusion, by a giving injection, by a kissing, sexual contact, and here one can have by a transplacental and direct contact with the skin and via the feces. So, entry into the human body, the bacteria that can be from the mouth, from the eyes, conjunctiva, scratch, through the break in the skin, arthropod, insect bites and other bites, then through the skin via the anus, alimentary tract or the GIT, urogenital tract, and the respiratory tract. These are all sources of entry into the human body, causing the infection or shedding the bacteria, and that is going to spread to the other